So everybody is more than 50. Most of them haven't done their screening. Yeah. So we can bring the fit kits and give it to you all, but don't wait until that happens. Please go and do your cancer screening. Very important. I'm Sujith. I'm a doctor by profession. To be more specific, I'm a surgeon, and I volunteer in Queenstown Multi-Service Centre. Queenstown also has an aging population and also one of the oldest neighbourhoods in Singapore.
Thank you, doctor. Thank you very much.
Basically connect with elderly because they are actually kind of isolated because most of their children, they have their own families and they are busy with their own things, and they are basically looking for people to talk. And most of my patients are also more than 65 and I enjoy doing that. I hope they enjoy too. So I moved to Singapore in 2009. So we settled down here, so then we had a child here, she was born here. Initially, when I started working here, it was a bit stressful because getting used to the way people move here and all these things I had to learn. The language also, and all this other slang we use, like, you know, when a group of friends go out and they don't invite you or forget to invite you, the more you interact with people, then you realize, oh, so all these terms actually mean something. But I had some good mentors, I had some friends. Through them, managed to blend in. The culture, the food as well, because slightly different from the food I used to have in Sri Lanka. Basically, we have this understanding that where the queue is longer, that's where you should go. So,
is it true?
I think it's true. Yeah. So living in Queenstown is basically quite convenient. Basically to get to work, get to my daughter's school. She's in P4 now. We are a bit careful that whether she will do well another 2 years for PSLE.
I always like space. When I was little, I wanted to become an astronaut.
Why not a doctor?
Yeah, I want a doctor.
Because we already have a doctor in the family.
It's a bit hot, so maybe let it cool down.
Yeah.
So this is vegetarian, this is all vegetarian.
Okay, thank you. Because I'm vegetarian, so special.
My neighbor, elderly couple, they are very nice. Yeah, if there's any issue with their health-related things, they just call me. So they're quite happy that I'm next door, and I'm also happy because whenever I go there, she asks me to sit down. She wants me to eat something and all that after talking to uncle. So it's nice. I find it quite interesting that I'm needed, and there are people who look forward to see you, meet you, greet you, and I can deliver something from what I've learned to the community as well.
The moment you have been waiting for. 我们要现在做什么 ？Bingo! Oh, you look at all their faces. I want to play bingo. All the face all light up.
So Michael is our branch secretary as well for Queenstown. So through him, I got involved with QMSC, and then that was a good opportunity for me to get into community, do some community education activities. So QMSC Alexandra was quite a good combination for me, and I was acting as more like a collaborator between the two and getting people for health education talks.
Understanding Dr. Sujith is very passionate about helping the needy, you know, and the poor, especially in Queenstown. He does squeeze in time, whether after work, during work, or even over the weekends, either to help us organizing the events, the talks, the events, or even conducting the events themselves. So we are quite blessed.
他有爱心，我觉得这个医生第一要有爱心，很仔细的，很关心人家，关心人家的生命，关心人家的 body， 就好像关心自己的 body， 啊，这样很好，他好，我觉得很好。
I like to see how happy they are after talking with me, and I'm quite glad that if I could make a difference to at least 1 or 2 people, give something from myself, at least 1 or 2 people, I think that's the most important thing. I would like to see Queenstown as a society where everybody can give and take from each other, and especially with the aging population, want to make sure and to see that they are healthy and they can still lead a healthy life.
Thank you.
Okay, bye-bye. See you.